Good evening, everybody. Thank you for joining our very first virtual education series program. My name's Kathy Alderman. I am the Chief Communications and Public Policy Officer for the Colorado Coalition for the Homeless. Many of you have probably been able to attend these events in the past, and we did have to put a pause on them because of COVID and not being allowed to have too many people in the room and shifting responsibilities, but we're glad to be back with all of you and hopefully a lot of new people as well. Want to let you know that this is being recorded and we will be sending it around afterwards along with the presentation. You'll notice that your microphone and your video are often muted and will remain so throughout the event. We hope that you will turn off your video if you have it on, and that way everybody will be able to see the speaker more readily. If you have any questions during the presentation, please submit those through the chat feature at the bottom of your screen. And our moderator, Ryan Camp, will try to get to as many of them as possible during the 3 breaks that we have planned for questions. There will be multiple opportunities to engage using our live polling, which you can participate from your computer or phone. All of your responses will be completely anonymous, but it will help with the conversation flow and keeping folks engaged and informed. We'll go over the directions on exactly how to use the Poll Everywhere app as we get the presentation started. Somewhere around 6:30, we're looking forward to having the Lieutenant Governor Diane Primavera join us to talk briefly about some health equity and homelessness issues that are taking place in the state of Colorado. We will pause this presentation to welcome her and listen to her remarks. Unfortunately, she's not going to be able to stay for questions and dialogue after, but we will then launch right back into the presentation. As I mentioned, we will be providing a recording of this event and the presentation afterwards through an email. And so now I would like to turn this over to 2 of my team members, Meredith Ritchie and Jill Corbally, who are going to walk you through the presentation and the evening's discussion. Thanks again for joining us.
Hi, I'm
everybody.
Oh, go ahead, Jill.
Good evening, everybody. I'm Jill Corbally. I am the Digital and Community Relations Manager here at the Colorado Coalition for the Homeless.
And I'm Meredith Ritchie. I'm the Director of Communications here at the Colorado Coalition for the Homeless.
All right, let's get started. So hopefully a good number of you were able to tune into our Poll Everywhere to start. But we're going to give everyone else an opportunity to log in. You can either do it on your browser or you could do it on your phone browser as well. So you're going to want to go to pollev.com/CO coalition. And you can either type in your name or it'll generate a guest number and you can remain anonymous that way if you would prefer. So we're going to do a practice run here. We want to know, where do you live? All you need to do is click on the county where you reside. Great. Glad to see it's working.
Ooh, look at that. Lots all over the place tonight.
Yeah. Okay, we'll give just a couple more seconds on this. Awesome. Okay, so unsurprisingly, a lot of folks in the Denver metro area, but we do have some folks outside of the Denver metro area. Just want to let you all know, because the coalition concentrates our services in Denver, we will have more specific Denver data, but hopefully we'll cover statewide data as well. And we're happy to answer any questions that we're able to do that we know of statewide information, and we can certainly follow up with information as well if we don't know it. Okay, one more Poll Everywhere question before we get started with tonight's presentation. How has homelessness touched your life? Give it a couple more seconds. Okay, it looks like we have a pretty big mix. And it's good to see, even though a lot of folks that do not know anyone who's experiencing homelessness are interested in learning more and becoming an advocate.
So now that we've kind of talked through all of our relationships with people who have experienced homelessness, we wanted to give you a little story of someone that we know. This is Joyce, and I just love her smile, and the sign that she is holding says, "You'll never know when illness hits and all you want to do is go home." For Joyce, she experienced her third heart attack while living on the streets. Her first heart attack happened when she was fully employed. She had a great job as a paralegal. Her second heart attack happened and she lost her employment. And then she had her third heart attack while living on the streets. She was found by one of our case outreach workers and was able to help her get housing. I think this sign is really telling of our times right now, to know that when we are talking about COVID and thinking through homelessness, we all just want a safe place to return to, especially when we're experiencing any type of illness, and Joyce is a perfect example of that. So we want to give a little bit of a broad overview first, and then be able to hone in on some more data that's more specific to us here in Colorado. But when we think about homelessness, the number that we are absolutely positive we have is about 567,000 nationally. Now, we anticipate that this number is probably at least 3 times as high as this actual count, but this is the number that we have that is the cold hard fact of homelessness.
I apologize, folks. I'm not sure why there is a odd yellow line that looks like it's drawn on the screen. So I'm hoping, Meredith, do you think you could share your screen? And
sure.
Hopefully that's not happening.
You have to turn yours off first.
Okay.
Okay, give me 1 second, please. Okay, and I'm just gonna slide us through to here. Okay, so I hope you all heard that we are talking about homelessness. We're talking about 567,000 people nationwide, but that there is some flexibility in that, knowing that we're thinking at least 3 times that number.
So we want to talk about how we know the number, the little over 500,000 folks that are experiencing homelessness across the nation, and why we think that that number is so much greater. So we do know the number of people experiencing homelessness based on the point in time count. This is a national count that is done every year, and it is voluntary, and it is volunteers and service providers that are going out into the community and where services are provided, and physically counting people through voluntary interviews. So and I always forget the right date, but in 2020, the date was sundown January 28th, I believe, until sundown January 29th. And it's during that 24-hour period where people had slept that evening of how people are counted. So the different things that are counted for the point in time are demographic information, including age, gender, race, ethnicity, if they're an unaccompanied youth, which in Colorado is 25 years or younger, or if they are an individual and part of a family. Just want to note, if they are an unaccompanied youth, there is an entire different section of the point in time count, including that have a lot more questions, including if they're being trafficked. It also tracks the length of homelessness, whether someone is unsheltered or sheltered, whether they've experienced chronic homelessness, which is defined by HUD as someone homeless for 1 year or longer continuously, or experiencing homelessness 3 times over a 5-year period. It also asks other questions: if someone has a substance use disorder, if they have a chronic mental illness, if they're actively fleeing domestic violence, and their HIV/AIDS status. So one thing to keep in mind is this is all voluntary and it is strangers asking other strangers. So it is a lot of personal information to ask someone to disclose. So it's really important to note that the point in time count follows HUD, the Department of Housing and Urban Development's definition of homelessness. And their definition is someone who is either sheltered or unsheltered. Sheltered meaning someone that is staying in transitional housing or in an emergency shelter or cold weather shelter, or they are unsheltered. These are folks that are sleeping out on the streets, in parks, in their cars, or in like abandoned buildings. Oh, and I apologize. People that are living in their cars are not counted. Who else is not counted are during that 24-hour period, someone that is in jail, someone that is in the hospital, someone who was able to pay their own motel room, and couch surfing. So if they stayed on a friend or family member's couch. So if you're thinking about those who have been counted and not counted during that 24-hour period, you can see why we know there's over 500,000 people across the nation, but we think that that number is a lot more. So there's a lot of benefits to the point in time count. It provides a snapshot of homeless demographics. We can see trends and what service needs there are. If 1 year there's a lot more people that identify a chronic mental illness, we may be able to put some more funding or have legislation focusing on mental health services. It's also an opportunity for community volunteers to actually go out and connect with the homeless community. There's not many opportunities to actually connect and talk to people experiencing homelessness, and this is one way for folks to do that. It's also a lot of community awareness. Often in the news, people experiencing homelessness or homelessness in general is seen in a very negative light, and this is an opportunity to not just to hear the facts and hear what is going on. That being said, there's a lot of pitfalls to the point in time count. Volunteer participation varies annually. If 1 year you have 10 people in Denver volunteering, they're not going to be able to count or interview as many people as 100 people. So it varies annually how many volunteers. Because it takes place in January, the weather can be drastically different. We all know that in Colorado, it could be sunny and 70 degrees, or it's in the negatives and many inches of snow on the ground. And with that fluctuation means people are utilizing services if it's really cold or if it's dangerous to be outside. The location, the landscape services play a large role in rural areas. There's not enough people to conduct the surveys, and the community and the media tend to take these numbers at face value because there's not that opportunity to explain why numbers are so low.
So we want to talk about Colorado now that we have a general idea of how we're counting and how we know these numbers might be. So first is a total count. So you'll see that more than 60% of the entire population of people who have been counted, which is around 9,616, 60% of them are in the Denver metro region. That leaves about 40% that are outside of the Denver metro region. We know that people who are experiencing homelessness are often trying to be close to services, which a lot of the services in the state of Colorado are located in the Denver metro region. So it's just a natural observation that they would be in that space. And then we want to talk a little bit about population breakdown. So like I said, there are a total of 9,619 people throughout the state. And then what you'll see here is how we break these down. The most important numbers, I think, to kind of look at and explain a bit is chronically homeless. So we determine chronically homeless, or the HUD's definition of chronically homeless is someone who's experienced homelessness for 1 year consistently or 3 times over a 5-year period. We also know that unsheltered, as Jill explained, are people who are sleeping in cars and abandoned buildings, etc. Unaccompanied youth are those under the age of 24 years old. So that can be anyone from a toddler up to a teenager, as long as they might be with other teenagers or other kids, but they are not with another adult. And then individuals and families. This is one of the growing populations of people experiencing homelessness, is individuals and families. When I think we think of the face of homelessness, it's one person and it's one person sleeping outside. But these are families with children who are attending school or trying to go to jobs and have their children be cared for while at home. One other point of data that we want to talk about a little bit is in the month of July, our partners, Denver Homeless Out Loud, did a count of tents in the Denver area. This was in part to find out, are we seeing an influx of people experiencing homelessness during COVID? And what we saw that, yes, in fact, we were. Now, the population breakdown that we're talking about here is across the entire state, but that number was just in the city limits of Denver, which is about 1,300 people they were estimating, with more than one person often in a tent. We want to touch on this just a little tiny bit about overrepresented populations. One, because we know that we can't possibly just have one slide and move on, which is why we have a full education series next month that will discuss this topic in great detail. But I think what's really key to look at here is we're talking about huge disparity between people experiencing homelessness and general populations within the Black and African American communities, multiple races, and Native Americans. These representations are 2 or 3 times more within people experiencing homelessness. Another demographic of people who are often underrepresented is the LGBTQ population. You'll see here that we included a tiny URL. This is a report that we've written that explains this in full detail of the reasons why and kind of the systems behind that and what people are doing to change that. The last thing we want to talk about right now is have you all pull out your phones or your computers one more time and type in just one word. If you type in a sentence, it's going to jumble it all up, but one word that you would use to describe homelessness. Thank you for all of these. So I see heartbreaking, sad, complex, complicated, misunderstood, inhumane. All of these are really great words for us to be using. Inequality, to talk about people who are experiencing homelessness in our community. So we're going to move on to the next one. We'll have a minute here for questions. Ryan, have you received any questions yet through the chat feature that we might need to address at this moment?
Hey, yes, I have one here. So someone said, that's an astounding amount of uncounted at-risk people. Would there be a benefit to a subsection of the count to allow for further funding, reach out, help? Would these uncounted folks be accounted for in the US Census when they do not have an address? How can we create opportunity to reach out to those in the gray area?
Jill, do you want to go ahead or do you want me to?
You can go ahead.
Okay. Good news is we have been doing a ton of outreach around the census work right now to help determine the count and to get a better, more accurate representation. And to answer the other piece of that question about demographic breakdown, there are quite a bit of breakdowns within those demographics. And of course, some of the challenges are that you have to have counters in order to get to that data. So it's hard to do in rural parts of the state. There's not enough volunteers to do that. So that's kind of one of the challenges around getting a full count that we know would be an accurate representation. I would love to see a question like that on the census to get a more realistic picture, but we're not there yet.
Do we have time for a couple more?
How about one more? And can we, whoever has the ability to write on their screen, if you could please delete whatever you've written, because I think it's just going to kind of play on through all of our slides. So if you have that option, can you please erase your last word? Perfect. Thank you so much.
Awesome. Thank you. Okay. So the last one, you kind of addressed this, but I'd be curious to hear what y'all would define homelessness as, because I know that there were different definitions. Someone asked, how would you define homelessness?
I'm not sure if the coalition has a specific definition that we have used in our over 30 years of existence, but I think we would follow more of the public school system's definition of homelessness, where it is someone that does not have a fixed address. If you don't have a place that you know where you're going to be laying your head every evening, then you don't have security and stability.
Got it. Okay. Thanks. We'll wait till the next round of questions for more.
Sounds
Great.
good. So we want to talk about the causes of homelessness. The coalition tends to, we break down the causes of homelessness into two buckets. The first being broken systems. So we have the affordable housing shortage, jobs lacking livable wages, generational poverty, systemic and institutionalized racism, the criminal justice system, limited job opportunities, and public benefit barriers and restrictions. These are all systemic ways that folks wind up experiencing homelessness or poverty and are kept in poverty or homelessness. But we want to focus on affordable housing shortage and jobs lacking livable wages this evening. So we're going to show you 3 maps. What we want you to focus on mostly are the different colors. So first we have a map that is showing the affordable and available rental homes per 100 extremely low income renter households. Now you notice that the darker the color, the red, those states have fewer available units for people at extremely low income levels that can find affordable housing. Even though we are not bright red, our number is 31. So we are just on the verge of having that red color. And last year we were in the red. This next map is the hourly wage that a household must earn to afford a 2-bedroom apartment. And if you're looking at Colorado here, we are in the dark blue. It is the most expensive. So while it's not California's over $34, Colorado is over $25 for statewide. And if we're talking just about Denver metro area, that number jumps up to needing $29 per hour to afford a 2-bedroom apartment. And for people that are in the mountain communities, that number sometimes jumps up into the 30s. This last map is the total number of people experiencing homelessness by state. There are other states that do have a lot more people experiencing homelessness, and you'll notice it's mostly on the West Coast, with, of course, California having a really high number with over 150,000 people. And now we're going to flip back through the 3 maps. Do you see the colors? They kind of all tend to be the darker colors in the same states. We wanted to show you these 3 maps in a row this way, so you can see there is a direct correlation between the cost of living in a state and the amount of affordable housing available and the number of people experiencing homelessness.
The other area that we discuss in pretty great detail is situational barriers leading to the causes of homelessness. So some of those include trauma, unexpected medical bills, physical disabilities, substance use disorders, eviction, intimate partner violence, job loss or lost wages. And mental illness. That one disappeared rather quickly. But the one that we want to talk about today is trauma. And again, here's another tiny URL to a report by the National Healthcare for the Homeless Council that talks about trauma in great detail. But we like to make sure that we mention that trauma is often the cause, but always the result of homelessness. We think of trauma in a cyclical way, that trauma can cause housing instability, which can lead to homelessness, but homelessness also can cause trauma, which leads to housing instability. COVID's impact on all of this is, I am going to put in this tenfold. We are going to see so much more trauma as the impacts of a public health crisis are unfolding simultaneously. Again, another article for you to take a peek at in great detail that talks about trauma of homelessness. This article specifically discusses a case study that came out of Rochester, New York, where 300 families who were experiencing homelessness were interviewed and studied, passed not beyond their homelessness into 2.5 years of being housed. And what we always saw are the details that were very common, threads that were common throughout this, were trauma and low self-esteem were the two leading causes of their homelessness. So we see a direct correlation between trauma and homelessness, and can show that in many studies that exist throughout the country. So I think we're going to pause now. And are we ready for our guest?
Give me 1 second to unmute. It's a bit of a delay. Okay.
And then Kathy.
Oh, great. Hi, everybody. Well, it is my honor to introduce Colorado's Lieutenant Governor, Diane Primavera. Lieutenant Governor Primavera was elected alongside Jared Polis in 2018 and has been leading efforts on increasing Coloradans' access to quality, affordable health care, including mental health care, for which the state actually released a statewide blueprint today. So we might hear a bit about that. Diane's personal battle with cancer is what has inspired her to make her life's work to ensure every Coloradan has access to health care. In 2006, Diane was elected to the first of 4 terms in the state legislature, representing Broomfield, Superior, and parts of Erie. Throughout her service, she was highly regarded for success working across the aisle to promote Colorado's small businesses, lower prescription drug costs, and expand access to affordable health care. She's a lifelong Coloradan and a Broomfield resident. Thank you for joining us today, Lieutenant Governor, and we look forward to your remarks. It may take just a couple of seconds for your unmuting to happen.
All right, can you hear me? Perfect. Okay, well, so good evening, and thank you for having me at tonight's meeting. As you just saw in the really great presentation, homelessness and access to housing continue to be important issues that we have to address. When I see these presentations, I realize really how lucky I am and have been. As you know, our robust economy has created opportunities across the state, but the rising cost of living has made it harder for many families to live the Colorado way of life that we would like all families to live. Over the past decade, the increase in Colorado's housing prices has been amongst the highest in the nation. About 30% of Coloradoans spend over 30% of their household income on housing, and 272,000 low and moderate income Colorado households spend more than 50% of their income on housing. And that was before the pandemic, which, as we all know, has deeply exacerbated these challenges. Families who have lost jobs have suddenly found themselves unable to afford a roof over their heads, even when they were stable at the beginning of the year. Shelters have been forced to serve fewer people, to abide by social distancing guidelines, while also experiencing a reduction in staff and volunteer support due to the fear of catching COVID. Our mission is even more critical now because we know that secure and safe housing is essential to everyone's ability to stay healthy. The state is committed to helping every Coloradoan have a safe, stable, and affordable place to call home. That's why earlier this year, we launched the State Homeless Task Force. This task force has done important work identifying needs and gaps within the state and working to fill them with local, state, and federal resources. It's also helped share key federal housing guidance with partner organizations, and it has helped local communities coordinate the stakeholders needed to develop and implement housing solutions at the local level. This task force meets bi-weekly with local leaders, providers, and advocates to inform and coordinate local and state efforts and provide webinars and guidance on state and federal actions. We've also turbocharged our work with community partners across the state to ensure that we have an integrated and collaborative approach to housing and stability. We work with our local nonprofit partners and local governments to do outreach to individuals experiencing homelessness. Our partners help us identify people who need immediate sheltering, and we work together to identify the best location for them. We're also working with local communities to identify and secure locations for sheltering. Based on the Center for Disease Control's CDC recommendations, as a state, we are focusing on increasing non-congregate sheltering. This includes partnering with local hotels and motels to serve as non-congregate shelter locations across the state. We also must recognize that homelessness, as we've heard, is not caused by a singular factor. So therefore, there's no silver bullet solutions. It's no secret that Colorado is currently experiencing a lack of affordable housing at critical levels. There are a number of issues in addition to the affordable housing shortage that we need to address to tackle homelessness, and that is the rising cost of living, behavioral health issues like substance use disorders and mental health, lack of access to health care or educational opportunities, a broken criminal justice system, and unstable family situations, which especially impact LGBTQ+ youth. There's an entire continuum of housing insecurity at play here. We need to make sure that we're providing comprehensive solutions to serve the many folks who are on this housing instability continuum, including the ones that are not most visible. And we must bring a sense of urgency to the problem, because the longer someone experiences homelessness, the less likely they are to get back on their feet. Ending homelessness is a public health response. By building on the power of the community and working together, we can continue identifying and implementing effective solutions to homelessness and lack of access to affordable housing. Since the start of the pandemic, the state has been able to provide critical assistance to thousands of individuals and organizations. This year, we've approved and provided technical assistance for over 23 counties and municipalities to create nearly 4,000 non-congregate shelter options for people in need of a place to quarantine or socially distance. In addition to these newly created options, the state awarded $7 million of HUD funds to 34 local partners for emergency homeless response in July 2020. The State Emergency Operations Center is also encouraging emergency and cold weather shelters to stay open and, where possible, explore new sheltering opportunities that are non-congregate to follow public health guidelines. As the chair of the Colorado Commission of Indian Affairs, I've been convening regular meetings with urban American Indian and Alaska Native serving organizations, including the Colorado Coalition for the Homeless Native American Services Program. This program works directly with our American Indian and Alaska Native community to offer services, including talking circles. These talking circles allow American Indian and Alaska Native individuals a space to receive substance use support in a culturally responsive manner. In addition, Serve Colorado, the Governor's Commission on Community Service, which is also located in my office, has AmeriCorps members assisting individuals and families experiencing homelessness by providing housing support, emergency shelter, and food security in the San Luis Valley and Southwest Colorado. And finally, the Governor's Office of eHealth Innovation, or OHI, as we call it, which is also in my office, has provided telemedicine funding and innovation opportunities during the COVID-19 response to organizations that support individuals experiencing homelessness or at risk of being homeless. This includes providing funding to the Colorado Coalition for the Homeless to purchase telemedicine backpacks and expand telehealth services to provide care to their clients in the location of their choice, meeting clients where they are. Additionally, the state is working with local communities to identify and secure locations for sheltering for Coloradoans without housing. The process of identifying shelters with space and also locations that can house people safely takes time. We're also looking at non-congregate sheltering, which is the CDC's recommendation during COVID-19. This includes partnering with local hotels and motels to serve as non-congregate shelter locations across the state to meet the needs of everyone, which is everyone who's without a home during this time. It's imperative that we keep building on this great existing work. So in closing, to maintain the safety for everyone in the community, to prevent and reduce the spread of COVID-19, the state will continue to support communities to implement intensive and comprehensive outreach, supportive services, and housing placement for individuals living outside or in shelters to quickly connect to services and housing. We must all continue working together to help address homelessness and housing instability in Colorado. Adequate and sustainable housing is crucial, especially during times of economic uncertainty and global pandemic. At a time where the home is the safest place to be, we need to make sure people have a home to stay safe in. So thank you again for having me tonight. I wish I could stay for the entire meeting, but unfortunately I have another commitment, but thank you for inviting me.
Thank you, Lieutenant Governor, for joining us. Please do feel free to stay as long as you are able and would like, but we certainly understand that you have other obligations. And we will jump back into our presentation. I'm not sure if I'm handing it over to Jill or Meredith, but I'm sure one of them will take the lead from me. Thanks again.
I believe it's you, Meredith, if you can share your screen again.
Okay, give me just 1 second to get us back to where we were. Oops. Can you all see my screen right now?
Yes.
Okay. And you can hear me. Okay. I think we're here. Okay, so everyone back on our same page. I needed to get back on the same page. Thanks so much to the Lieutenant Governor for joining us tonight. And there's so much that she has mentioned that we're going to go into more detail about, so I'm excited for that as well. And we started to discuss support in our community. And let's start here. So what we're talking about in supports are a few different things. There's kind of the emergency services. Those are the trampoline, jumping off from homelessness into what might be a short period of time or an extended period of time while experiencing homelessness. So those include things like street outreach, shelter services, cold weather shelter services, which are a bit different, re-entry engagement, food banks, hotel vouchers. Those are the things that are immediate, emergent issues that we're trying to address as a community. And then things like that are long-term stability are healthcare, case management, employment services, substance use treatment, public benefits, and then ultimately housing. So all of these work together. Some you might not need at all, some you might need all of, and sometimes they overlap. So you might be housed while still receiving food bank food services, or you might be housed and still participating in re-entry programs. So there's a lot that can happen and that they can overlap in a lot of different ways. But it's important to know that all of these things are happening throughout our community on a regular basis. What's also important to know is that the system isn't perfect. Some of the things that are really imperative to understand are health conditions by age, which I'm going to go into in a little bit more detail in a minute. Limited funding and resources. This is kind of the thing we're always talking about, that we need more money to be able to provide the services that we need to provide to our community. Service hours and location. Sometimes they're difficult to get to, sometimes they're not open at all. Identification and documentation. We know that 50% of people experiencing homelessness get their identification stolen within the first 72 hours of experiencing homelessness. Aging out of foster care, difficulty using vouchers, and shelter barriers. But like I said, we want to talk a little bit more about health conditions by age. People experiencing homelessness have a life expectancy of 47 years old. That is 30 years younger than their housed peers. Let that sink in for a second, because that is shocking to me to know and to read about. People experiencing homelessness not only die significantly younger, they also have much more physical and emotional barriers to their health, that we often see people who have the physical ailments of someone who is 20 years older than them. Again, here's another report that goes in fine detail explaining all of that and gives you a lot more stats on all of those pieces of information. Ryan, any more questions that we want to address right now?
Yes. Okay, can you all hear me?
Yes.
Okay, so the first question is, can you all speak on any reason for the increase in camping around the city in parts of Colorado?
I think we could turn that over to Kathy Alderman for this one.
Hi, thanks. Yes, so we are seeing an increase in camping across the state. Obviously, it's much more visible in the Denver area, and I think there's a few reasons for that. One, I think we are seeing an increase in the number of people experiencing homelessness and entering the cycle of homelessness because of the economic downturn and in response to the pandemic. Two, I think people that traditionally may have been more likely to hide or to camp in an unseen place are finding more community by camping together. And so they're more visible in larger encampments because they're kind of coming out of the alleyways and coming away from places where they've been hidden and seeking that safety among community. And then the third reason is, I think right now, because we know with COVID that congregate settings are the least desirable places to be in many instances, people are choosing to camp rather than go into shelter. Shelter capacity has been reduced by nearly half because of physical distancing requirements. I think our shelter systems are doing, and facilities are doing the very best job they can in keeping spaces clean, providing masks and other PPE, and providing as much space as possible. But because of fear of contracting the virus, I think many more people are staying outside or choosing to stay outside rather than going into shelter.
Great, thank you, Kathy. Ryan, any more questions for right now?
Yes, we have, next question is, what is the Denver mayor doing to create more permanent camps for people experiencing homelessness that include toilets and showers?
Great, so I can jump in and say, you know, across the state, we don't really have any sanctioned encampments as of yet, though we have heard from communities in different areas that have experimented with this idea. And a proposal has been put forward to the mayor for safe outdoor spaces in Denver. The mayor requested that city council members suggest potential locations. So far, none of those locations have come to fruition yet, but there are ongoing conversations. Our partners at the Colorado Village Collaborative, who I would highly recommend you look into and check out because they're doing some great work helping people that are experiencing homelessness, is working with the mayor's office. Unfortunately, we're seeing a great deal of community pushback against having encampments in any given area. Many of those areas are areas where people are currently sleeping and currently camping. So we're going to have to find some general political will and some community building to come together to get some sanctioned encampments available for people. The idea behind these spaces is not that they are permanent. It's just that we do have so many people sleeping outside that it would be much better to provide in a harm reduction way a place for them to camp, receive services, and have access to restrooms and hand washing stations. We also know that if these sites are set up, we can then take healthcare into the camp and do testing to make sure that there's not a COVID outbreak in the camp. So I think there are a lot of benefits for us to move forward and to look at safe outdoor spaces as an emergency response and a way, to really address the problem as it is currently today, so that we can connect people to long-term solutions in a more meaningful way.
Great. Do we have time for one more, Meredith?
Sure, go ahead.
Okay. So the Lieutenant Governor mentioned a task force. Was the task force involved or aware of any of the recent sweeps that took place at the camps?
That's a great question. I'm actually a member of that task force, and yes, the task force was aware that these encampment enforcement actions were taking place, but has not necessarily been able to develop a precise policy on what to do with encampments. The CDC guidelines, I think as has been mentioned, recommends that you do not move people from encampments during COVID because that could further spread the virus and expose people in those camps to the virus where they might not have otherwise been exposed. So I think there are a couple of things that we have to think about when doing sweeps is, well, one, we would advocate that you do not sweep people from encampments in the Denver area or anywhere else in the state because it's not safe for the individuals and it's not recommended by public health experts. We do think that services can be brought to encampments to help with sanitation, both on site and personally for people individually in their tents. We also know that sometimes encampments, there are real public health and criminal activity concerns. And so we would encourage police to patrol those areas in the same way that they would patrol any other area, because the safety of the campers should be our very top priority, as well as making sure that there's not community harm. So the task force, I think, is in the process of talking through these issues and developing a more comprehensive COVID response plan from a public health perspective.
Got it. Do you mind if I do one more follow-up question to that?
No.
Do we have time for that? Great.
Yeah.
So this is a question that kind of addresses how complicated this issue is and finding a space. So someone asked, why not use public parks? Isn't the city responsible for those areas? They could bring in porta potties and showers, etc. Can you speak on why that is more complicated than you might think?
Yes, so public parks have additional restrictions that would have to be waived, including curfew requirements, accessibility requirements, and I think that there might be a way to come to a place where we could agree on a space for people to camp that could be a public space or could be a city-owned space. There just are some additional hoops to jump through. There's also the issue of access. Who gets access to what spaces? And I think that, when you're thinking about where an encampment might be, is that going to impede on the access that other people might have to that space? So I don't think that it's impossible to think about a potential park space for for a sanctioned encampment site, but I think right now there are some additional hoops that you have to jump through, and there are some zoning issues to be considered.
Thanks, Kathy.
Thank you. We're gonna move on. Again, I see that someone is writing on the screen. I think we got your question, so we will save that for the next round, please. If you could please erase what you've been writing, that would be helpful. We are trying to make sure that we get to everybody's questions, so I appreciate you posting it, and then we will work around that. Jill, go ahead.
Thank you. So jumping back into talking about services, we want to talk about the services that Colorado Coalition for the Homeless is providing. The coalition focuses on 3 service areas as well as advocacy. So our big focus is housing, healthcare, and support services, which we'll talk about what that means, but I kind of call that the everything else. So let's start talking about housing. We have 19 housing properties, and we're housing over 3,000 households every year. This includes our housing properties as well as our partnerships with local landlords that are housing people as well with vouchers. We're also doing some really cool things. We want to be as innovative as possible, and homelessness is not going to go away by just doing the same old thing. So we try to do as new things as often as we have the opportunity to. So I want to talk about our Renaissance downtown lofts. If you're ever driving in Denver on Broadway and 21st, I believe, you'll see our Renaissance downtown lofts building. It's a really interesting shape. We had to build the property on a very small piece of land. And the Renaissance Downtown Lofts houses 100 individuals who are part of a 5-year program called the Social Impact Bond. It is a private and public partnership with the idea to reduce jail visits, detox, and emergency room visits among people that are experiencing chronic homelessness, with the idea that if we can reduce these visits by housing someone, we will save taxpayers and the city money. Within the first year of doing this project, it was saving enough money that the city actually decided to double down their efforts and provide additional vouchers to house more people. The next project we want to talk about is one of our recent properties, Fusion Studios. This was I believe, a Holiday Inn that was renovated just a couple years ago near Martin Luther King Boulevard and 38th, I believe, or 36th Avenue. We were able to purchase this hotel and do some minor renovations to be able to make them into studios to be able to house people that were currently experiencing homelessness. What makes this so innovative is that generally when we purchase a property, a piece of land to actually build housing, it could take about 3 years from the concept to actually building it to be able to move folks in. Fusion Studios, because it already existed and it was renovated previously, we were able to do the same process in 11 months.
Our next service that we are so very proud of are our healthcare services. We provide what is called integrated care. So that means everything that you would need for regular care is in one building. And that's really about access for the people who are using those services. We serve 15,000 people per year through our healthcare services. That's at our South Street Health Center and then satellite locations, including our HOP, which is our mobile unit. And that's really important that we work to provide services to people where they are at, not just for them to come to us, but if they are coming to us, the benefit is that they can receive all of their services almost always same day and can go through dental, eye care, primary care, behavioral health, access our pharmacy, all under the same roof with the wonderful peer support and case management services that we offer as well. We want to talk about innovations in healthcare too, because I mean, I love our health center, but there's some other really cool things that have happened in recent times. And one of them is telemedicine reimbursement. Woohoo! This is awesome news for us. If there is any silver lining of COVID, it is telemedicine reimbursement. for Medicaid and Medicare reimbursement. So prior to this, we would provide services and we would not get reimbursed for them to our rural communities that need access to medical care. And now we can. And this became part of the emergency fund that happened federally, and then also when we were in legislative session this year, that it became a statewide Medicare reimbursement. The Lieutenant Governor mentioned our cool backpack. Here is Nina wearing our cool backpack that allows us to provide street medicine. So it has all of the tools and tricks and important medical equipment necessary to provide services on the street to people experiencing homelessness, which is really, really key, because building a relationship with someone sometimes takes time, but their wounds don't. And so we have to figure out how to bridge that gap and be able to provide services to people where they are at in the most comfortable space that they can be in. And this is the way that we have resolved to do that. It's a really neat way to address the care that people who are living in tents and in other parts of the city and beyond can receive care. Support services is another area, and we kind of refer to this as the everything else. So housing and healthcare, we know, are really just such important things to the way that we provide care, but our support services also are the wraparound services of things like childcare, re-entry, vocational services. All of that together is key to the way that we provide our services. And this year alone, we had 5,700 clients that had 4,100 visits. So that might mean that they come back multiple times to discuss any different issue with their case manager. So it might be about getting employed or getting access to benefits. It could be coming to our talking circle. It could be going to our child care program. So there's lots of different things that are going on simultaneously throughout our organization. They're happening. Sometimes one client might be going to multiple services, or one client might just be going back to the same service over and over again. Some of the innovations that we have in support services that we love to talk about is our Fort Lyon program. Fort Lyon is near and dear to all of us. It is a supportive residential community in Los Animas. It is a place where people can go to recover from any type of substance use disorder that they may have. This is key for a space where people have a supportive peer-led community, so that it is based on their own determination of how they wish to recover. And the uniqueness of this program, in addition to it being removed in a space where you can live for free with food and access to all of these resources, including art. This is an art room that you're taking a look at right now. The other wonderful things about this is that you can stay there for 2 years. So what we know about treatment and recuperation from substance use disorders is it takes time. And a lot of the 30 or 60 or 90 days that exist in the communities around us for substance use, it's just not enough time. And so this is why this program has been built, and it's been since 2013 that we've had it. And it's been really lovely to see the transition of a lot of our residents there. You're on mute, Jill.
Thanks, Meredith.
Mm-hmm.
So the last thing that we want to talk about that the coalition focuses their efforts is not direct services, but advocacy. And we will definitely be going more into our advocacy work, because we're hoping that you will all either are advocates or will become advocates. But the coalition, Meredith and I, under the leadership of Kathy Alderman, are part of the education and advocacy team. We're a small team of 5 people. With Kathy Alderman and our Director of Advocacy, Aubrey Hasfold, actually providing lobbying and in charge of grassroots lobbying as well. So during the 2020 legislative session, it was a different session, as with everything else happening right now, than any other year. It was actually interrupted. So it was a shorter session than we've had in the past. but we were able to testify and lobby on quite a few bills. And with the help of our CCH advocates, we had 715 emails go to our legislators to discuss bills that were important to the coalition and the people that we serve. And we had 20 bills that had our desired outcome, whether we did not want them to pass because they were detrimental to the services we provided, the people that we work with, or they did pass so we can help more people next year. So we can't go through this presentation without talking about COVID-19. Not only has it affected everybody, but it has especially affected people that are at risk of experiencing homelessness or are currently experiencing homelessness. We want to show you a video. This is Julie. She is in New Orleans, so it is different than here. However, the situation is the same. I recommend going to YouTube and watching this full video from Vice. It is called Eviction During a Pandemic, and it's only about 15 minutes long, but it is really telling of what is happening across the nation. Oh, looks like we can't hear the audio, Meredith.
Meredith, when you click share screen, can you make sure that
Yeah, I didn't do that. Give me 1 second. Let me try again. And click the sound button because that's important. Okay, let's give it a go one more time.
Jackie Shahan experienced the harshness of the law firsthand. She was evicted in court in early July for non-payment of rent. Since she lives with her 2 adult sons and a daughter with severe disabilities, the judge gave her 2 weeks rather than 24 hours to leave her house in the Bywater neighborhood.
She's been having a rough time with the move. You think that?
Yeah, I think she's like overwhelmed and, you know, stressed out. She's like a baby, so she's like a pacifier. She's always putting her hands in her mouth or always trying to get the top off of her bottle. You know, she's got tricks. She's 25.
Yeah.
You got tricks? Hi, telling on you. I'm a cafeteria lady. When coronavirus hit, I lost my job. COVID is, it's like a curse that won't go away. And even though nobody in my house has been sick, and I'm thankful for that, it has been traumatizing. I absolutely have no income. My daughter hasn't received any type of stimulus check or any type of extra grant or benefits.
When did you know that you weren't going to be able to make rent?
I had already applied for renter's relief, but I eventually got denied for that services because I'm not on any public services. I had a court notice on my door to show up to court on June 6th. So I was being evicted for non-paying of rent. I said, I have $2,800 for you. We'll come up with a verbal agreement before we even go to court, and I could save my home. He said, I'll see you in court. I got to watch the judge evict 4 people prior to me, so my hopes were very low. So I'm panicking, and it's my turn. And then he says, okay, well, she's gonna give me $2,800. What about July's rent? Well, I didn't have July's rent. And he says, you know what, Your Honor? You just give her your money back, because I don't want to rent to her anymore. And the judge said, okay, so this Friday, I will have no place to go. I will be homeless with my daughter out on the street.
Trying to get out till Wednesday.
Quentin Cole.
This is not my skill set. Give me 1 more second. Okay, can you guys see that now?
Not yet. There we go.
Okay, so strategies to address homelessness in a COVID world. We have to have those, right? That's really key to trying to address the pandemic, is that we can't just look at homeless or look at the pandemic in isolation. We have to address all of the people that it's impacting. And here are some ways that we strategized of how we needed to address this at the beginning of the pandemic. The first was de-densification. That was really key when we looked at shelter spaces, that we knew that they were just too crowded and to adhere to that 6-foot guideline. So how would we de-densify? How would we do screening and testing? And to whom would we do that? And in what capacity would that look like? But we knew we needed to do those things. We also needed to determine where we could put people once we knew that they tested positive, if we did that screening and testing. And this was something that the Lieutenant Governor was speaking about a little bit ago. Those 2 different types of hotel motels that we used, we called activated respite, were for people who tested positive for COVID or were in recovery from COVID, or protective action. And those are for people who are high risk. So it might be someone who's elderly, who has pre-existing conditions, etc. We knew that we also needed long-term housing options. Pandemics don't go away overnight, and while we have lots of emergency services that we were planning to put in place, we need to think through what this would look like long-term and have more housing stock. This is with or without COVID, we need more housing, and we are very aware of that. There's just a more urgency during COVID, of course. And then vouchers and services. So we also needed to figure out how are we going to be able to provide services to people and vouchers to people when we were already seeing an increase of people experiencing homelessness due to evictions and other job loss, etc. So how we did that, once we thought of all those strategies, the first thing to do was we got 800 hotel rooms that we developed for protective action and activated respite. When we de-densified the shelter system, and this, when I say we mean in partnership with other service providers in the community, as well as the city government. And so we de-densified the shelter system as well, which included adding 2 auxiliary shelters, the Denver Coliseum and the National Western Complex, which now is just the Denver Coliseum because we were able, we didn't need as many beds during that time frame over the summer months. What was also really key in all of this was that we were adding 24-hour shelter access. So we can't say to someone, come into a shelter and then leave at 6 o'clock in the morning tomorrow and then spend your day milling about in the community with the potential to spread COVID. So making sure that we had 24/7 access so people didn't need to pack up their belongings and leave and come back all the time helped to mitigate the risk of spreading. The other way that we were working to mitigate risk was to provide cloth masks and hygiene products to people from our street outreach programs. And that was imperative to making sure that we were doing that safely and effectively. And then as we discussed, the safe outdoor space is still one of those things that we haven't been able to check off the box yet that we have started to do. But the plans are in the works. We just need that public will to do so. And then last but not least, you're muted. You're muted.
Got it now. We are currently partnering with Denver Public Health and the Denver Department of Public Health and Environment to conduct testing of people that are utilizing Denver shelters, folks that are using the auxiliary shelters that was the National Western Complex and the Coliseum, and that is currently just the Coliseum, as well as people that are unsheltered and in encampments. So we started back in May we got funding for a pilot testing, and it was around, I believe, the peak in Colorado and across the nation. And we found a 19% positivity rate. Since then, we've continued to do routine randomized testing at the different shelter locations, and we have seen the positivity rate drop immensely. And so we're currently around 7 to 9%. And this is varying because some shelters are recording a 0% positivity rate, and a few others are a little bit higher. But it is continuing to go down. However, we do know that there are at least 602 positive tests, and of the tests that where the case has been closed, 123 required hospitalization, which was a little bit over, I believe, about 21% of people that tested positive. And we know at least 13 people have passed away in Denver alone that were experiencing homelessness. So the future of COVID, we're hoping this is not the future, but there is a possibility that homelessness across the nation could increase by 40 to 45%. And we do know in Colorado, at least 400,000 people are at risk of eviction. Now, while the CDC did put out an eviction moratorium, that can be challenged at any time and be revoked. And even though the CDC did put this out, there is no current plan for once it expires, and no assistance for all the back rent that will be due.
So what do we do about it? What do we need to move forward during a pandemic while we are already experiencing a housing crisis and a homelessness crisis? We need federal rental assistance, a national eviction and foreclosure moratorium, long-term housing. And I think this has kind of been another silver lining, is we can't use this crisis as an opportunity and just, we must use this crisis as an opportunity and not return to business as usual for homelessness. So that is really the key, is this needs to be on the front page of every paper and at the top of every conversation, that we need these long-term housing solutions. We need to make sure we maintain an eviction moratorium, and that we have the necessary rental assistance. Healthcare-wise, we need to continue to test. We have seen that we in Colorado have great access to testing, and that's been really great for us to be able to do, because we can immediately, once someone is tested, remove them from a shelter and put them in those hotels so that they are safe and can have the opportunity to recover without spreading the virus, which includes those treatment and isolation locations. We need to be able to maintain those long term. We need a vaccine, and we know that from the governor's message the other day, that when the vaccine becomes available, there will be prioritizing of vulnerable people, and so of course some of the people who are experiencing homelessness will be included in that as well. And mental health needs due to ongoing trauma. This is really such an important part of the pandemic, is that we are all experiencing some level of trauma on a regular basis now while housed. And so adding the homelessness piece of that to mental health, we are going to really need to focus on addressing that trauma.
So as I mentioned before, I want to go back to talking about advocacy work. During our much shorter advocacy our legislative session in Colorado this year, there was some great success. Previous to this year, only Denver and I believe Boulder, Aubrey, Kathy, feel free to correct me. It was illegal to discriminate based on a person's source of income, meaning if someone was receiving student loans, alimony, child support, or housing vouchers like Section 8, landlords were able to say no, that they would not accept that as a source of income. However, now it is going to be the law for statewide. We also had a passing for rent assistance. This is emergency rental assistance, and reimbursing healthcare providers for telehealth services, as Meredith mentioned before, that we're now able to do as well.
So looking ahead, and here's where we need you, if anything, to pay a lot of attention right now, because the future is really important to our people who are experiencing homelessness. And so we need to do something about that. And if you are in Denver, we are about to set our next slide. We'll get a little bit more into our ballot measure, but what the measure does, so you understand, is it would allow for $40 million per year with a tax increase of 0.25%, and that is the sales tax. It has support from the mayor and city council members, and it needs your support as well. So it will be on the ballot, and we will have on our next slide some more details of how to get more information about that. We also, throughout the rest of the state, we need to address for the legislative session, basic life functions and protecting our housing fund. So basic life functions in public spaces means that someone who does not have an option to go to another shelter or a safe home can live outside without being punished and criminalized for that. So that will be on the next legislative session and something to keep an eye out for. And then always, we must protect housing funding sources in Colorado. They are always on the chopping block, and we are going to know this year where we have had an increase of a lot of spending due to COVID, that this is even at greater risk. So one more polling question, because we want to know how you would like to advocate. So this helps us determine how we need to gear our messaging to you so that we can get you to participate in things, because we want you to be able to do that. So if you can take out your phones or your computer one more time and text to ABCDEF, I think, all the way to H. And so it says that we have results, but it's not showing. I guess that doesn't show on this one.
Oh, looks like you can select show responses. Not sure why I didn't do that automatically.
This?
Yep.
Okay. Haha, okay.
There we go.
Okay, perfect. So it looks like we have a lot of people who are interested in affordable housing, mental health services, safe outdoor spaces. Awesome, awesome. I am so happy to see that no one has picked none of these. We're in the right room. Wonderful, thank you. And then here are our next steps, and then we'll have a few minutes left for questions. So like I said, the measure that is for the city of Denver is measure 2B. So what you can do right now is take out your phone and text solutions with an S, CO, to the number 52886. That will prompt you to sign up for an email list where we will be able to email you on this measure. You can also go to yeson2b.org to learn more and to do your own research on that ballot measure. Please do both of those things. We want you to be involved. Always, always, always encourage your state elected officials to make homelessness and housing a priority with investments in those resources. So we can talk all day about priorities, but we need the financial investments behind those to make sure that we are able to provide the necessary services, as we know that they will continue to increase. We will continue to see people experiencing homelessness, especially during our pandemic, and especially as we move forward through the winter months. Look for an action alert. If you signed up for our event today, you are going to be on our email list. So good for you, because you're going to get an action alert, which gives you an opportunity to participate and tell your policymakers what you want. So that'll be from the Eviction Task Force, policy proposals. And then last but not least, like I mentioned earlier on, we discussed that we will have a full education series event on revealing racism, inequality in housing, healthcare, and employment. That is October 28th. How you signed up for this event will be the same way that you will sign up for future events. So you can either do that through our website, coloradocoalition.org, and then click on Get Involved, or you can go to Eventbrite and type in Revealing Racism and sign up and join us there. And then not only do we want you to do these things, go to Facebook, go to Twitter, sign up for our emails and participate, or go to LinkedIn. We want you to do things there. So especially during this election cycle and with the ballot measure happening, we want to hear from you, and we want to hear what's going on in your community so we can support and we can get your support. So please participate in all of these activities. And then we have some minutes for questions.
Great. Okay, so we have this first question, well, a couple of questions that relate to each other a little bit. And the first is, has there been any pushback from hotels providing non-congregate sheltering, or are they happily providing rooms? And then how much are hotels charging for the rooms you've taken, and who's paying for it?
I will unmute Kathy Alderman again. She will definitely be able to answer this question.
Hello, I'm back. To the first question, we have been able to work with some motels, but obviously not all of them, to secure rooms, as Meredith said, for activated respite purposes and protective action purposes. That's for people that are recovering from the virus or who need to be housed away from potentially getting the virus because they would likely need hospitalization or critical care if they got the virus. We've had some hotels that have been more receptive than others. Many hotels have, different concerns around security, services, staff. And so for all of the hotels that we have entered contracts into with, we've had to provide staff on sites. In some instances, we have to provide meals and other services. And so it really has varied site to site. I know that across the state, there are other organizations looking to contract with hotels and motels for homelessness purposes. And some communities are having a really hard time finding hotels to enter into those agreements. And so we're hoping that with continued federal funding and potentially some state incentives and funding, that we might be able to get more motels and hotels to help us out, especially as we come into the winter months. To the second question, because COVID-19 is a public health emergency and a disaster, FEMA, the Federal Department of Emergency Management, does pay for required emergency response. And so FEMA has been paying for these motel and hotel rooms on a reimbursement basis, meaning that they provide 75% of the funding to the community to respond to the crisis. And then the community must match that with the additional 25%. So again, it can be really difficult for smaller communities that don't have a great deal of discretionary funds to come up with that 25% match. Some of the federal funding that was approved several months ago through the CARES Act can be used for some of the matching, but not all of it. So it's a pretty complex funding mechanism, but we are continuing to work with the state to make sure that we, as long as we remain in this disaster, we can keep people in these motels and hotels safely housed. And then we can start working with them on a long-term housing solution, what we refer to as rehousing. How can we move people and make sure that people aren't released from motels and hotels back to the street, but instead are moved into a more permanent housing option, freeing up the space in those motels and hotels for additional individuals.
Great, thank you, Kathy. Okay, so we have what looks like a three-pronged question, and it is: how do housing vouchers work? What is the average rent for your locations? If there is a wait list, approximately how long are people on it? And finally, are there any other organizations that are doing similar housing programs as CCH? And if you'd like, I can toss those to you one at a time. So the first was, how do housing vouchers work?
Well, I think all of those questions could be a 3-hour presentation at least. They're pretty complicated. For housing vouchers, there are so many different types of housing vouchers, and it essentially works like a coupon. So folks receive a housing voucher and it helps to subsidize rent payment, and it is based on fair market rent. And I believe, Kathy, definitely correct me if I'm wrong, it's about 30% of a person's income is what is paid by the tenant, and the remainder is paid by the voucher, and the funding sources for those vouchers can vary from local, state, and federal levels.
Great. Are there any other organizations that are doing similar housing programs?
So there are different organizations across the state that we work with to administer housing vouchers and to get people housed. And there are other organizations that have their own buildings that they own and operate that provide affordable housing and low income housing and accept housing vouchers. I think, you know, the coalition's mission is obviously directed at people experiencing homelessness or to prevent very low income people from entering the cycle of homelessness. And there are some other organizations that have done, in addition to providing shelter and support services, have started to provide housing. But I think we may be the largest housing provider for people experiencing homelessness in the state.
And then I think the last part of that question was around a wait list. Is that right?
Yes.
So something in the 7-county Denver metro region, we use the coordinated entry system. So any service provider that has housing options for people experiencing homelessness use the same one bucket of options for services and for housing services. And so that means that a person might go to the coalition or to another provider and say, I'd like to be on that list. We use the vulnerability index, which is kind of an assessment to determine how vulnerable someone is in their homelessness. So some of the measures of that might include being elderly or having a disability or having a chronic illness or having children. And so that would move you up higher on the list. And then if you don't have as many vulnerabilities, unfortunately, moves you lower on the list. So the people who receive services are often the ones who are obviously the next in line on vulnerability. So it can take, depending on how quickly housing is built and how all of that is managed, it can take up to a year or longer to receive housing. Now, there are some exceptions to that rule where there, like Jill's mentioned, there's lots of different types of vouchers, and some of those vouchers don't apply to using the coordinated entry system and kind of are secondary to that, and that may be a shorter time frame. So there's again a lot of intricacies, and again a whole nother presentation that could take a lot longer to explain, but that's like the Cliff Notes version of it.
Great. You touched on this a little bit, but someone asked, what is the reality of emergency housing availability in the Denver area right now? Are there any emergency housing resources available for folks in crisis right now? And if you could also add on, what are some possible solutions to the dearth in availability of emergency housing?
I would say anyone needing housing is in need of emergency housing, and unfortunately that's a lot of people, and we're just seeing it going up and up, and there's just not enough housing. If we're thinking back to that map of the number of affordable and available units available for very low income households, which would be people that are experiencing homelessness or just at risk of homelessness, there's not enough. There's not even close to enough. So we need more, and there's just a long waiting list. Was there I think there was a second part of that question.
I think it was just what you answered, which is possible solutions.
One of the solutions, and this is a plug for vote on 2B, so we can get more housing, because that's what we need. So there are things that you can do, and one of those most important things is we need public will. We need public will to